Hi and welcome. In this tutorial, we will be talking about the triangles of the neck. I know there are a lot of channels that make videos on this concept. What makes this video different is that it is going to be an audiovisual approach to learning anatomy, focusing on the eye-aid stuff and step-by-step freehand sketching. So by the end of this video, we would have learned the cervical triangles, their boundaries and their content. The cervical triangles begins around the base of the skull. It has its boundary posteriorly by the trapezius muscle and anteriorly by the midline of the neck. Inferiorly, it is bounded by the clavicle and the mandible sternum. So this triangle is further divided into two large triangles by a muscle that runs superior-inferiorly at its point of attachment around the mandible sternum, the sternocleidomastoid muscle. The sternocleidomastoid muscle divides this triangle into two large triangles known as the posterior triangle that is located posteriorly and the anterior triangle which is located anteriorly around the midline of the neck. So the posterior triangle is now bounded by the anterior border of the trapezius muscle, and anteriorly this triangle is bounded by the posterior border of the sternocleidomastoid muscle. The posterior border of the sternocleidomastoid muscle. The base of this triangle is formed by the middle third of the clavicle around the mandibular sternum, the lower part of the neck. The apex is formed by the point of attachment of the two muscles, the trapezius muscle and the sternocleidomastoid muscle, around the neutral line of the base of the skull. The point of attachment of these two muscles forms the apex of this triangle. So the posterior triangle is now further divided into two smaller triangles. It's further divided into two smaller triangles by a muscle that runs superior-inferiorly from its point of attachment around the body of the hyoid bone inferiorly towards the clavicle, which is called the inferior belly of the omohyoid muscle. So the inferior belly of this omohyoid muscle divides the posterior triangle into a large triangle which is known as the occipital triangle superiorly, and inferiorly a smaller triangle which is known as the subclavian or supraclavicular triangle. So therefore, the occipital triangle is now bounded posteriorly by the anterior border of the trapezius muscle. And then anteriorly it is bounded by the posterior border of the sternocleidomastoid muscle. And then the base of this triangle is formed by the inferior belly of the omohyoid muscle. Then of course the apex remains the same as the point of attachment of the trapezius muscle and the sternocleidomastoid muscle, just below the base, around the base of the skull. Then we have the supraclavicular triangle. It is bounded anteriorly. By the posterior border of the sternocleidomastoid muscle. Then Posteriorly, it is bounded by the inferior belly of the omohyoid muscle, and then inferiorly it is bounded by the clavicle. The content of this posterior triangle contains branches of brachial plexuses, cervical plexuses, and blood vessels. You can do well to check more of this content from your recommended textbook in anatomy. Then we have the anterior triangle, which is bounded anteriorly by the midline of the neck. It is bounded posteriorly by the anterior border of the sternocleidomastoid muscle. The base of the triangle is formed by the lower base of the mandible and the line drawn from the angle of the mandible to the mastoid process. It is an invisible line drawn from the angle of the mandible to the mastoid process. So, the apex of this triangle is formed by the point of attachment of the sternocleidomastoid muscle inferiorly around the mandible sternum, point of attachment of the sternocleidomastoid muscle and the midline of the neck. Then the base of this triangle is formed by the lower border of the mandible and the line that joins the angle of the mandible, to the mastoid process. As for the anterior border, it is bounded anteriorly by the midline of the neck. Posteriorly, it is bounded by the anterior border of the sternocleidomastoid muscle. The anterior triangle is now further divided into 4 smaller triangles by muscles of the supra and infrahyoid muscles. Since we have this inferior belly of the omohyoid muscle, we have the superior belly that runs superiorly to a point of attachment around the body of the hyoid bone, which is known as the superior belly of the omohyoid muscle. And then we have 2 other muscles that collectively divide this anterior triangle into 4 different smaller triangles. Yeah, we have the digastric muscle, which runs posteriorly, and then we have its branches that runs anteriorly, which is known as the anterior digastric muscle. The digastric muscles and the superior belly of the omohyoid muscle collectively divide the anterior triangle into 4 smaller triangles, which are: number 1, we have the submental triangle, we have the digastric triangle, the carotid triangle, and the muscular triangle. The submental triangle is now bounded side by side by the anterior belly of the anterior digastric muscle, and then anteriorly it is bounded by the midline of the neck, and the base of this triangle is formed by the body of the hyoid bone. So it is bounded side by side by the anterior digastric muscle. Now, the apex of this triangle is formed, or it is located anteriorly around the chin. And once again, the base of the triangle is formed by the body of the hyoid bone. This submental triangle contains different lymph node, like the submental lymph node that drain the tongue and the central part of the lower lip. It also contains small veins that form the anterior jugular vein. Then, the second triangle here, we have the digastric triangle. The digastric triangle is a paired triangle and it is bordered superiorly by the lower base of the mandible and the line that joins the angle of the mandible to the mastoid process. Posterior inferiorly, it is bordered by the posterior belly of the digastric muscle, posterior belly of the digastric muscle, and then it is bordered anterior inferiorly by the anterior belly of the digastric muscle. The digastric triangle contains glands and lymph nodes. For example, we have the superficial part of the submandibular gland, submandibular lymph nodes, and some parts of the facial artery and vein. It also contains part of the hypoglossal nerve. The next triangle on the list is the carotid triangle. The carotid triangle is an important anatomical region in the neck. It is a crucial landmark for clinicians and surgeons due to the presence of major vascular and nervous structures in this region of the neck. As for its boundaries, it is bordered posteriorly by the anterior border of the sternocleidomastoid muscle. The anterior border of the sternocleidomastoid muscle forms its posterior border. And then, anterior superiorly, it is bordered by the posterior belly of the digastric muscle, and then anterior inferiorly, it is bordered by the superior belly of the omohyoid muscle. This triangle contains carotid arteries like the common carotid artery, the internal carotid artery, and the external carotid artery. Contain the jugular vein and also the vagus nerve, the hypoglossal nerve, and ansa cervicalis, which is a branch of the cervical plexuses. This makes this triangle a very vital region of the neck, as any injury to this part of the neck can lead to loss of blood supply to the brain, can lead to coma or loss of consciousness or even death of the subject. Now we have the last but not the least, the muscular triangle, which is also known as the inferior carotid triangle. It is bounded anteriorly by the midline of the neck and superior posteriorly by the superior belly of the omohyoid muscle, and then inferior posteriorly by the anterior border of the sternocleidomastoid muscle. Superiorly, it is bounded by the body of the hyoid bone, and inferiorly, it is bounded by the manubrium sternum. This triangle contains the infrahyoid muscles, which are the sternocleidomastoid, the sternothyroid, the thyroid muscle, and the omohyoid muscles. So other structures in this triangle are the thyroid gland, the parathyroid gland, the trachea, and also the esophagus. The muscular triangle is important anatomically, and clinically it is significant, as it serves as area of assessment of the thyroid gland. And also, during tracheostomy, an emergency entry into the trachea can be done through this muscular triangle. Alright everyone, if you find this video helpful, make sure you click the like button, share it with your colleagues, and for those of you that haven't subscribed to our channel, make sure you subscribe for more anatomical content. Thank you and have a nice day.